Hi everyone, welcome to this Neonates in a Nutshell. It's Amy and Gemma here, and we're going to be looking at the new NICU Central Line Care Bundle.
Hi, okay, so the reason that we have been looking at developing this Central Line Care Bundle is because over the last few years we have realised that on our unit we've got a higher average rate of infections compared to the national levels. If you have a little look on this graph on the right hand side, the red bar represents the national levels of central line infections and we are the orange. So you can see, although a couple of years ago we did very well, last year it bounced back up again. So what we've been working as an infection control group is to develop this care bundle so that we can hopefully get that rates down. So Gemma's just going to go through what we're doing.
Okay, so what does the Central Line Care Bundle include? So we're looking at education and feedback, insertion and adjustment, maintenance, access and daily review. And this includes training on the unit. It includes updates at mandatory training days for all staff and at the doctor's induction every 6 months. And also the infection control doing ongoing audits and feeding back to the team about how we're getting on. We've developed a new LOCSIP, which stands for Local Safety Standards for Invasive Procedures for the insertion and adjustment of central lines. And we also have LOCSIPs for accessing central lines as well. And then we've also got maintenance checklists and daily review charts, which we're going to go through now. So insertion and adjustment. So as you can see here, the purple form is our new central line insertion LOCSIP. This needs to be completed for all central lines that are put in on NICU, so that includes umbilical lines and long lines. And the key things to note is that insertion of any central line should now be a 2-person procedure. So primarily you have one person, the operator carrying out the procedure, and an assistant who is there to check off against the LOCSIP chart to make sure that we're adhering to each standard, and also to assist in the procedure to pass equipment and such as required. It's important to note that we must follow this, and at any point, if any stage of the LOCSIP isn't followed, the procedure should be stopped and consider whether we can proceed or whether we ought to start again. Also important to note that we realise in emergency situations it may not be possible to adhere to those, in which case that's fine, and we just need to provide documentation to support that. Also, you've still got to fill out the blue central line insertion record depicted there on the right, and that should be placed in the baby's notes. So looking at maintenance, this is a central line maintenance checklist which should be completed by nursing staff on a shift by shift basis. What you need to do is to confirm that you've adhered to the standards listed on the chart. So our standards for central lines are as follows: that sterile gauze should be placed under umbilical lines when babies are nursed in a prone position, and this is to prevent contact with the line site and dirty bedding and nappies and things like that. And that gauze should be changed if it's noted to be visibly dirty or soiled with blood or anything else. Umbilical lines should be kept outside of the nappy area, making sure that the nappy is folded down and away from the line site. We're also going to stop using Curos, which we currently do, and instead we'll just be using plain line caps. So confirming that those are in place. We're going to have blue for venous lines and red for arterial lines. And then finally, the other new standard is that the medical team should be informed if dressings or fixation of any central line is noted to be loose or soiled, and they should be aiming to come and change that within an hour. So as I say, this needs to be completed on a shift by shift basis. Nurses can just tick off and then initial at the bottom to say that the standards have been adhered to, and if they haven't, then you just need to provide some written justification in the notes to describe why and what happened. Access. So these are the LOCSIPs for central line access. We've got 2 different ones. The green one is for accessing central lines for changing infusions and fluids, and the red on the right hand side for flushing, for giving bolus medications, or for blood sampling. And the important thing to note here is the differences in the PPE that should be worn. So coming on to infusions and fluids on the right here, again, these should be a 2-person procedure, which they would be anyway, because you're going to have 2 people for checking your drugs and your fluids. And the person actually, the operator, the person actually carrying out the change of fluids and infusions should be wearing a full sterile gown, sterile gloves, a theatre cap and your face mask. Again, you need to just work through, tick off to say everything has been done, and then both should sign at the bottom. And again, just to note that these should be completed for every episode where fluids and infusions are changed. So if this is more than once a shift, then this should be completed more than once a shift. Moving over to your Access Lock-Zip for blood sampling, bolus medication and flushing. It follows the same procedure as the other one for fluids and infusions, with the exception of the fact that you just need to continue to wear this normal sterile apron and sterile gloves. And again, this should be completed for each episode, and this includes both nursing and medical staff accessing central lines for any of the above reasons. Finally, we have the daily review. So this should be completed by the attending consultant on the ward round in the mornings for babies with central lines. And what they need to do is write in the date, confirm which central lines are in place, and write the plan for the day, whether that is that the lines are to stay in situ or to be removed, and then sign and print. And you'll notice that on day 6 there's a prompt there in red that if central lines, umbilical lines particularly, are to stay in situ beyond 6 days, we need to provide some written justification, because we know that the risk of infection increases greatly from this time onwards.
Cool, so I think that's everything. So hopefully that's clear. If there's any issues, please feel free to chat to one of the infection control team for more details. But just to let you know that the bundle packs have been made up and they're kept in the doctor's office. So they're next to the blue central line insertion record sheet. And so, yeah, hopefully we will implement this over the next coming months. We'll be auditing it to see how things are going, and fingers crossed we will be getting some of our infection rates down within the next few months. I think that's it.
Thanks very much. And as Amy said, any questions, let us know.